discussion. We have already a nice series of questions coming. I would like to invite Gian Maria Busetto to speak about micronutrients impact in male infertility. Please, Gian Maria, you have the microphone.
Thank you, Professor, for the presentation. I will go ahead with my presentation.
Please.
And it's a pleasure to share with all of you my data, my experience. And let's share the screen.
Yes.
Do you see my slides?
Yes, perfect.
Good. So I love always to start with the slide that is this one. And I would like to show you how is changed the feeling regarding the male infertility between the past and between the present. So if you look at here, it's written that this was an article of the New York Times in 1982, and this reported how the infertility was something most men never had to face, because almost potency and fertility were considered synonymous, and in many societies, if a marriage was barren, the solution was to get a new wife. So if you look at this vision that was not so many years ago, something like 40 years ago, while you think that today that doctors agree that men are responsible nearly for 50% of the male infertility, and this other article that has 4 years and that is reported that the infertility crisis is beyond doubt. Now scientists must find the cause. There is a study from the University of Hebrew in Jerusalem that is reporting that we have an average 1.4% of decrease of our fertility per year. So this is really such problem. It is really something that we have to take care. And during these 40 years, we try to understand as much as we can regarding male infertility, and we even try to introduce a new concept that this paper of 2015 is reporting, that infertility, male infertility, can be even considered as a proxy of our general health. So is it true that when you have a decreased fertility, even your health is not so good? So there are many papers and many reports at this regard. For example, this paper that analyzed more than 2,000 patients and made a comparison between the Charlson Comorbidity Index, which is a system to evaluate our comorbidities, and the fertility, and reported that all the parameters of the sperm, including the concentration, including the count, and even the hormones, are reported to be altered in patients having such kind of comorbidities. Even this gentleman, this professor, Professor Salonia from Milan in 2019, in our latest Congress of the European Association of Urology in Presence that was held in Barcelona, reported a mechanism to try to explain how this male fertility can be connected with our fertility. And it's a complex system, including all the axes from the hypothalamus to the testes to the adipose tissue. So all these changes report even the changes in our fertility. But what we know about male fertility causes, because this is really the big problem. So how many causes of male infertility do we know? So we know for sure that something like 30% are idiopathic. So this means that something like 30% and probably even more, we don't know the real cause. Then we know that between known causes, the varicocele for sure is the most represented. So we have something like 15% of male suffering from varicocele that have male infertility. And what about the diagnosis? Which is the diagnosis process with these patients? So what we do is usually a semen analysis that it seems to be a simple exam, but is really important in the routine diagnosis. But unfortunately, it fails to detect any abnormalities. So it's really important to do a correct semen analysis with all the latest quality control and quality assurance. But semen analysis is only able to make a diagnosis, not to detect the reason of this semen alteration. And the 5th version of the WHO is the actual one, but is coming out the 6th version that will be updated. and it is important to refer to these values. The endocrine part that has been reported for the female from the Professor Gianzani really well, it's really important even for the man, because when you have an alteration in testosterone, in LH or FSH, in the inhibin B, in the prolactin, all these hormones are reported to be connected with male infertility, as well as genetic testing. That is another common reason of male fertility, because when you have an alteration of cystic fibrosis gene, the Y chromosome microdeletion, abnormalities in chromosome, and all of this genetic alteration can be the cause of a severe oligospermia or even to azoospermia. But when you have excluded to have a genetic cause, when you have excluded to have a varicocele, or when you have excluded an endocrine situation, unfortunately you have you don't know which is the real cause of this infertility. And this is why in the latest years several different tests to evaluate better the sperm came out, and mainly they are made by the assessment of the active oxygen species, really important. The assessment of the DNA fragmentation, because DNA fragmentation as well can be reported in infertility. Test that reports the function of the sperm, so acrosome reaction, anisomia, and others like this, together with biochemical tests. So all of these tests connect us to another concept, because what I want to introduce now is a new concept that has been delivered in the last 2 years, and I am one of the members of this new concept that has been released in 2019, and we published this concept that is the male oxidative stress infertility. The nickname is MOSI, because it's the male fertility that is related to oxidative stress, to reactive oxygen species increase. So once again, as you can see, when you have genetic, hormonal, varicocele, systematic disease, lifestyle, almost in 50% of these cases, you can give a reason to male infertility. But unfortunately, something like 50%, and in other series, something like 30%, you are in front of idiopathic infertility, and you are not able to explain why it's common, this infertility. And this is why we introduced the new concept of MOSI. And to make a summary of what MOSI is, when you have an idiopathic male infertility in which a man has an altered semen characteristic without an identifiable cause, and if there is not a female factor, this is a challenging condition and it's difficult to explain why. The oxidative stress can affect negatively this fertility, including interference with capacitation and damage to sperm membrane and DNA, which may impair the sperm potential to fertilize an egg. Male oxidative stress as a novel descriptor for infertile men with abnormal semen characteristic and oxidative stress. Oxidative reduction potential can be a useful clinical biomarker for the classification of MOSIs. So we try to give an explanation of why in this 50% of idiopathic infertility, the fertility is not perfectly functioning. And probably the oxidative stress and the alteration between oxidation and reduction can be the cause of this infertility. And this oxidative stress male infertility can be even measured. And to measure the oxidative reduction potential can be a biomarker, so that can help us in making a real measure of this oxidative stress. As you can see here, there is a big difference between oxidative reduction potential between abnormal semen and normal semen. And in the last report, we even found that 1.34 is the cutoff to divide between who has the normal oxidative reduction and oxidative reduction potential, and between those that have increased oxidative reduction potential. And in fact, this can help us even in guiding the therapy, because when you have a male infertility and you measure the oxidative stress, when you have something that is even connected with the inflammation, you even give the therapy together with the antioxidants of antibiotics and anti-inflammatory. When you have a problem with your lifestyle, you can counsel the patient to change his lifestyle. When you have a varicocele, you can counsel the patient and you can suggest him to make a varicocelectomy surgery. But when you don't find varicocele, inflammation, lifestyle, or other causes that you can take care of, you will give antioxidant supplementation and then retest the oxidative reduction potential to see the effect of this antioxidant supplementation. This is why one of the easiest ways to measure the oxidation reduction potential is the Myoxis. It is a machine that has been released something like 3 or 4 years ago. And it's really easy because it's really effective, is not time consuming, is portable, is cheap, and it's something that can help you so much in making this evaluation. Substantially is calculating the statistic oxidation reduction potential and the capacitance reverse. All of these data are normalized with the sperm concentration, and then you will have a number that will indicate to you if the oxidation is too much. And as I told you, the last cutoff that is used is 1.34. But if you look at the beginning of the experience with this machine, the results was really good, because this is probably the first paper that has been delivered with the Myoxis. And in this paper is you can see as how there is such a big difference between higher ORP or lower ORP. In this case, the 1.48 was the cutoff, but now we have continued our research, and now we are using 1.34 as the cutoff. This is another experience, more recent, with up to 600 patients, and here is reported really a big difference between higher and lower ORP in comparison with male fertility and sperm parameters, with an area under the curve of 0.7. So it's something that is statistically significant and something that is helpful for us. At this regard, I would like to explain to you the concept of oxidative stress and why the oxidative stress is important to understand better the male infertility and to better understand that is important to take care of the oxidation and reduction and even to do some therapies in this situation. Oxidative stress can cause damages to the sperm at every level, can act on the head, on the midsection, and on the tail of the spermatozoa, because it can make damages on the DNA part of the spermatozoa, can act on the natural defenses, but even on the sperm tail that are important for the movement. You have to take in consideration like that the oxidative stress and reactive oxygen species are like some pinballs that bounce over the sperm, creating damages every time that they bounce over the spermatozoa. In fact, when you have a slight increase of ROS, you will start having membrane damage that will go through membrane instability, functional alteration, and if it's really high, the reactive oxygen species, you will have cell death. This is why it's important to distinguish between high concentration and moderate concentration of reactive oxygen species, because it will be completely different the action on the sperm, because you will have immobilization till the cell death. So for this reason, having a correct measure of the reactive oxygen species is really important at this regard. But even regarding the mitochondria and the energy metabolism, because the reactive oxygen species that goes inside the mitochondria can have a bad action on the energy metabolism. And as you can imagine, it's really important to have a correct metabolism of the energy in spermatozoa that have to go through the egg. And at this regard, we can keep in mind that there are even some medical treatment that can keep the balance between this oxidation and reduction, and the antioxidants might help in keeping this balance between production and clearance, because you have to keep in mind that you don't have to reduce as much as you can the oxidation, because a part of oxidation is useful for the capacitation and the acrosomal reaction. So if you lower too much the oxidation, you will have, once again, a bad action. So you have to keep, as with the scale, the correct balance between oxidation and reduction. In this regard, the carnitines has been extensively studied as antioxidants to keep this correct balance. And they are really important because L-carnitine can help bringing energy inside the cells, but even removing toxins from the cells. So as a double effect on the metabolism of the cell of the spermatozoa. And some literature to explain you why it's important to know the carnitines effect has been reported starting from 2005 with this important paper came out on fertility and sterility, where 60 patients have been enrolled and have been treated in 3 different groups, with placebo, with acetyl L-carnitine, or with the association between L-carnitine and acetyl L-carnitine. And as you can see, all the parameters of the sperm, motility, velocity, progressive velocity, all of these parameters increased statistically significant differently between those that were taking placebo and those that were taking the carnitines. This graph helps you understand the results. The association between L-carnitine and acetyl L-carnitine is the best to obtain the results in the motility and in capacity of the sperm to be better in terms of fertility. Even the pregnancy rate, even if it was a secondary endpoint, reports that 9 pregnancies out of 12 occurred in patients taking the active treatment. Only 2 pregnancies resulted in the other groups, and so even in these parameters, the pregnancy rate, there is a statistically significant difference. There is even a meta-analysis that is analyzing several papers in this regard, and all of these parameters analyzed and report how everything is in favor of the treatment, even the pregnancy rate once again. So carnitines helps increasing your fertility. And here, sorry, this is the pregnancy rate, is statistically significant. But by the end, what is the truth and what we have to consider regarding the antioxidants? Because by the end, antioxidant should be considered as empirical medical treatment, because guidelines still doesn't report that there is a strong evidence in suggesting antioxidants. Even hormonal therapy, there is not a strong evidence to make a suggestion at this regard. But by the end, analyzing all the literature in the latest years, all the systemic reviews and meta-analysis suggest that oral antioxidants are able to increase in a significant way live birth rate compared with control treatments. So it seems to be effective, the treatment with the antioxidant, even if the guidelines, as I told you, still they cannot make clear recommendation at this regard. This is exactly why we should go ahead with our study, with our trials, with our double-blind placebo-controlled trials, in order to continue analyzing data, in order to arrive to a final suggestion regarding the antioxidant therapies. And this is why I would like to present you in the last part of my presentation our experience, because we are from several years that we are making experiences at this regard. And I would like to start with this paper that has been published in 2018 from me and with my group when I was in the University of Rome. And we try to understand better the capacity of antioxidant to increase male fertility. And at this regard, we made a study, a double-blind placebo-controlled study, a really rigorous study, because we really wanted to have real results. And for this reason, we used this trial to see if the sperm quality in subjects with oligo or astenoteratospermia and with or without varicocele can be effective in the treatment. Patients have been treated with antioxidant for 6 months, and a spermogram was made at the before the beginning of the treatment and after the treatment. This is the study, 104 patients, 52 with varicocele and 52 without. And then both of this group have been divided between those uptaking the placebo and those uptaking the supplementation. And the results are quite interesting because you can see on all the main parameters, the progressive motility, total motility, concentration, and sperm count, all of these parameters are in favor of the treatment in comparison with placebo. And in patients affected by varicocele are even more evident these results. And this is for this reason that with varicocele, all the parameters are almost, you see, almost all the parameters are statistically significant, but even on those without varicocele are statistically significant. But once again, the pregnancy rate that was observed as a secondary endpoint reported 12 pregnancies, of that 10 occurred in Proxeed treated patients, while only 2 in the placebo group and 1 was having an abortion. In order to explain you the importance of this study, of this trial, in 2021 came out this paper from the Men's Health Journal that is a report of highly cited articles in the field of male infertility and antioxidants. And our study is reported to be the 17th worldwide most cited paper. So this, once again, to confirm that our data are real, the study is well conducted, because there is a highly citation rate. And for this reason, this is the number 17 between the most highly cited papers worldwide. And even the compound that we used as came out to be the most prescribed worldwide, because this global survey that me, together with all the other colleagues, conducted worldwide, we saw that Proxeed is the most prescribed antioxidant worldwide. And even the elements included in the Proxeed Plus are the most prescribed, because the zinc is the most. The second is the vitamin E. And then there is the carnitine. So you can see that between the most important antioxidant worldwide, carnitine is the third one and is the most important element of the antioxidant that we are talking about. And all of these parameters are reported because of scientific evidence, and personal experience. So this is something that doctors are reporting after having experience with the patients and after gathering scientific evidence. So these data are important and are confirmed by evidence-based medicine. So once again, the importance of our trial. This is why with the same database, we continued and we analyzed better our data. And in a second paper, we analyzed on the importance of the body mass index and aging, how these two parameters can correlate with the antioxidant supplementation. And what came out is that a significant difference in supplementation efficacy was observed for total motility in patients with varicocele. And in the same group, also the progressive motility was significantly superior. And for the responders analysis, total motility results were confirmed in both the side group. So substantially, this second trial, the second analysis, report that supplementation is more effective in subjects with varicocele younger than 35 and with the body mass index inferior to 25. So once again, the importance even of the lifestyle and how the antioxidant can help in changing our lifestyle and our life habits. Because when you are younger and when you are not obese, the effect is better of the antioxidants. This is the graphs reporting what I told you. And this is, by the end, our new experience, because since the good results that we obtained with these two previous studies, we decided to go ahead with our research, and we decided not to stop only in looking at the sperm parameters. In this new trial that we are that is underway, we decided to look farther than the spermogram and the sperm parameters. we decided to look at the DNA fragmentation and to the oxidative stress measured by the myopsis. So this study, that is a placebo-controlled double-blind, once again, is on oligo and or asteno and or pterodospermia and with varicocele. So we decided to stay only in patients with varicocele and with OAT, and we measure on these patients the spermogram, the oxidative reduction potential with myopsis, and the DNA fragmentation. This is done at the beginning of the study and after 6 months of the therapy. And by the end, we would like to make a comparison between those taking the placebo and those taking the compounds. At the moment, we already have enrolled 26 patients. Today, we enrolled the 27th. So we hope by April 2021 to enroll 80 patients and conclude by April 2022 the enrollment, and to obtain, after 6 months of evaluating latest patients, the results by December 2022. So I hope to come soon to you with the result of this other interesting paper. This once again to confirm and to stress that as for any drugs, clinical efficacy of any natural compounds must be demonstrated by double-blind placebo-controlled trials. And with this, I conclude my presentation, and I would like to thank all of you.